Hello, my name is Mary King. I'm a nursing student at Joyce University. I'm in the Accelerated Bachelor's Program and I'm just finishing up my last week. Today I'm going to talk about how the Quality and Safety Education for Nurses Initiative, or QSEN for short, prepares nurses to have knowledge and skills needed to provide quality care that's safe for our future patients. QSEN has 6 competencies to help us learn and know how to do this. They are patient-centered care, communication and teamwork, evidence-based practice, quality improvement, informatics, and safety. Today I'm going to talk about each of these competencies and how they help us provide quality and safe care to our patients. The first competency that I want to talk about is patient-centered care. This means that care is given compassionately and that the patient is a full partner in making decisions about their care. In order to give patient-centered care, we educate, communicate, provide comfort and emotional support, involve family in the care, and we recognize boundaries. When we give patient-centered care, we're sensitive and we try to look at the healthcare situation through the eyes of the patient. As nurses, we respect patients' preferences, values, and needs, and ultimately, we respect their decisions regarding their care. The next competency that I want to talk about is collaboration and teamwork. This means that the nurse functions effectively within their interprofessional teams, that we collaborate, respect each other, and that we communicate with each other and share in the decision-making. We can do this by knowing our own strengths, values, and limitations. We can act with integrity, we're consistent, and we respect views of others. We acknowledge our ability to contribute and recognize the strength and knowledge of our team. Next is evidence-based practice. This means that we integrate the best, most current evidence within our clinical practice so that the patient and their families receive optimal care. We can do this by demonstrating knowledge of methods and processes, by researching evidence-based practices, by participating in data collection, and by differentiating between clinical opinion and research and evidence. On top of this, we can appreciate the strengths and weaknesses of science. Next comes quality improvement. This means that we use data to monitor outcomes and care processes, that we use methods to help us improve, and that we're continuously designing and testing ways to improve quality and safety in our work. We can do this by developing strategies to learn ways to have better outcomes in the clinical practice, by seeking information about the populations we serve, by seeking ways to improve quality of care, and by having a good attitude. Next is informatics. Informatics is the use of technology in healthcare. Technology helps us manage care, increase knowledge, and broaden the way we communicate with patients. It allows us to mitigate errors and make better decisions. Informatics can increase patient care and safety through things like telehealth, navigating the electronic health record, documenting patient care, communicating with a healthcare team so that care can be coordinated. We can teach our patients how technology in healthcare can help them, and we can stay on top of technology as it advances so that we continue to give the best quality care to our patients. The final competency that I want to talk about is safety. Safety is important in patient care, both for our patients and for us. When we implement safety, this means we minimize the risk of harm to patients and providers by being effective, smart, and through our individual performance. We can implement safety by using evidence-based practices, by examining human factors, and by applying basic safety principles. We can demonstrate effective skills, use technology in our practice, and it's important to be aware of our strengths and also our limitations. Quality improvement and patient safety has been essential in my education as a nursing student. QSEN has been a big part of that. In conclusion, whether we're in emergent care, same-day surgery, the operating room, mental health, labor and delivery, pediatrics, long-term care, or any other area that we want to work in, the Quality and Safety Education for Nurses initiative teaches us how we can implement quality care and provide safety to our patients.